Okay, so we're going to do low back pain. Low back pain can come from various forms of issues. So, the majority of people associate low back pain to one of the 3 T's. Now, do we remember what the 3 T's are?
Traumas, toxins, thoughts.
Rock stars! Traumas, toxins, and thoughts. So these are the 3 things that actually cause subluxation or cause problems with our body's ability to work. Most people associate low back pain with a trauma, a slip, a fall, sitting kind of funky. Here, I'll have you guys photocopy this, okay? A slip, a fall, and not working correctly. If it's trauma-based and it's a micro or a bunch of little ones, the pain will go away in 2 weeks. That's the average. Even if it's a disc herniation. And this is the funny thing. If you have a disc bulge and you do nothing for 2 weeks, the pain will go away. Because the body will reabsorb it. The body has within it, it's called innate intelligence. It's that intelligence that actually takes care of itself. It's that intelligence that is within us, that was given to us during conception and grew and basically grew into the different germ layers and then made us into the different organ, muscle, and gland layers. So if that intelligence can work correctly, it will absorb the disc back in and you'll go back to normal 95% of the time with nothing. Now, say you have it really bad where it rotates and the disc herniates or actually pushes out, that's a difference. That means that there's a structural abnormality, and that structural change will actually lead to the body not working correctly. And the only reason that happened is we have an imbalance in the function between the brain and the body. And that safety pin or communication cycle isn't working correctly. If the brain can't talk to the body and body can't talk back to the brain correctly, then we'll have a problem. Now that problem can be called whatever you want it to be. You look in the DSM or the diagnosis book and you can find thousands and thousands and thousands of diagnoses. And all a diagnosis is an explanation of symptoms. It doesn't really mean anything. It just means you have XYZ symptoms, so I'm going to say you have this, and we called it XYZ. A diagnosis by itself doesn't really tell us anything. It tells us you have a symptom. That's nice. How it works is you come in, you tell the doctor, I have toe pain. And he goes, okay, you have great hallucis, neuralgia or great hallucis, inflammatory process, whatever. I just said the same thing back to you in Latin. That's all a diagnosis is your symptoms said back to you in Latin. That's literally what it is. So the diagnosis, what we've been taught, the diagnosis drives everything, is not true. It's the ability to figure out the underlying cause of what's driving everything that we want to look at. And this is why allopathic or symptom-based medicine is not very productive all the time. Yes, we can help people when there's huge crises, but it's not going to help them stay healthy. It will help us stay alive, but not healthy. So I explain to people like this. Do you want to be not ugly or pretty? Do you want to be not poor or wealthy? They're different things. So do you want to be not sick or healthy? It's 2 different things. Not sick means the symptoms aren't there, and healthy means optimal physical, mental, and social well-being. It's a whole different ballgame. And what we're taught in Western medicine is to look at not symptoms. So we make the symptoms go away. And that's why there are 2 different intervention techniques that Western medicine uses. Cut it out or drug it to death. That's all they got. So I went off topic, but we'll talk about how the brain talks to the body and body talks back. So say we have one of those people that had a trauma. When you have a trauma, your body actually gets a hit, a fall, a trip. Say it's a car accident. Whatever position your body's in, so say you're looking at the red light, and then you looked over here, and then you got hit. When you got hit, now your body is rotated, your head is rotated, and whatever position you're in, your body resets, because the trauma is so big that will literally reset your hologram or how your body sees itself, and then it will tell you this is normal. And this is why people come in and they go, it hurts, I can't move my head any farther, because the body thinks this is normal now instead of this. So it's literally reset how it thinks it is. It's told the cerebellum, be tight here, make this relax, and this is normal, because we had so much stimulation going in. It's reset the loop to say this is normal. This is why when you do neurological or functional-based functional neurology on people, you can actually have the body stop that cyclical pattern of the neurology not working correctly, aka causing one muscle to spasm and another one not to. Have the body reset. So what do we do if we're a symptom-based person? We're going to go after the muscle because we're saying the muscle's the problem. But here's the issue with going after the muscle. If you go after the muscle, does the muscle drive itself? The answer is no. The muscle can't contract or do anything by itself. If you want to look at this and say, well, okay, doc, what do you mean by that? Have you guys ever heard of Erb's palsy before? That's those people who used to walk around like this. What happened with them is the doctor pulled them out by the arm. They're not allowed to do this anymore, but pull them out by the arm, rip the C8 nerve root, and all the nerves that go into extension, all the muscles that are extenders that are run by the C8 nerve root die. So he's stuck in flexion, or she's stuck in flexion. It used to be called waiter's tip. Walk around like this. So the nerve runs the muscle. If you don't have the nerve, the muscle dies. The muscle just doesn't exist. That communication runs everything. So the communication determines it. So do I want to look at the bone? Well, can the bone move itself? No. So do I want to look at the muscle? Well, the muscle can move, but what controls the muscle? It's the brain and the nerves. So if the brain and nerves are overfiring one side and underfiring another side because you've been in a chronic stress position, aka you've been in a car accident and then you had to go through all the junk after, you get into that sympathetic or general adaptation syndrome. This is Hanselia's work, and he talks about how you adapt. And when you adapt, you get stuck in stress. Now, being stuck in stress gets you to adapt a specific way. So what's that specific way? You pull your shoulders up, you pull energy away from the organs, so reproduction and healing stops when you're in stress. It's real simple. If those two things stop, what's going to start having problems? You're not going to be able to absorb proper nutrients. You're not going to be able to have the proper building blocks. Yes, Kim?
Okay, so this is totally off topic, but is this why we're having such an infertility rate?
Yes.
Because everyone's stressed out?
Yes.
I was just curious.
That's why we also have GERD. That's why we have all these autoimmune problems. That's why we have all these problems. It's because our body is so stressed out that we turn off our immune system. And when our immune system gets turned off because we're in a chronic stress, you have all these issues that look at symptoms, but this is what causes it. So let's go back to our patient or our person that's stuck to the side. If I massage that neck muscle that's really tight and allow it to move for one day, it's not going to change because the brain still says this is normal. And that's why you can't change it by massaging it. You can put a cortisone injection into it, and then the nerve endings will start to get sick and die, and the muscle won't contract properly, but then your body remakes itself. And then in 3 to 4 months, the problem comes back. And you go, well, this is bad, we're just gonna have to get rid of this. So why don't we do surgery and cut it? This is the order of things going. And this is looking at the symptom. And why don't you go, well, there's a bad communication loop. It's not talking to the muscle. Why don't we just turn that loop on and say, hey, why don't you look at this muscle and make sure it's communicating properly? And when we do that, then it turns on and it will relax if it's too tight or strengthen when it's too weak. And this is why when we adjust people in the very beginning of care, they come in and they say, I'm sore. And I go, excellent. That means you're working. That means the muscle that's weak is contracting and the muscle that's tight is relaxed. And you're working. Because the bones by themselves do not move. The muscles move them. But the nerves have to tell the muscle to move them. So it's a maladaptation syndrome or a faulty afferent-efferent signaling pathway. What that means in simplicity is bad information out, bad information in. Bad information in, bad information out. That's all it really means. That's the afferent-efferent stuff. So if it's not working right, that's how you get that rotation and the chronic misalignment. This is why we see women get chronic scoliosis where it's always to the right. Always, 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 always to the right. We were taught in school, if you see a left scoliosis, freak out because it means it's pathology and disease.
What?
If you see a left scoliosis, it's indication of a disease. If it's to the right, it's a idiopathic scoliosis, they call it, which means we don't know what it is, but we see it in a lot of women, so it's idiopathic. So what it is the brain is imbalanced. Majority of women are left brain or right brain dominant, 80% of women are right brain dominant. And so because they're right brain dominant, the right brain is going to be stronger, and it's going to cause the musculature on the right side to pull stronger, including the paraspinal musculature, which means it will pull it to the right. And that's why you see right scoliosis is in women. And that's why the majority of people who have scoliosis are women. It's just because of how they deal with stress. Because truthfully, in the world we live in, women have to be more defensive than men have to be. You have to be scared of things. We're taught these things. Compared to a guy. I have no clue of how you guys deal with things. All I know is I can walk down the street and I don't care.
I got broke.
And that's not how most women have to do. They have to think about things and they have to take care of things, and that puts you in a stress state. And being in that stress state, what will happen is your brain will go to the side that you are most dominant, and in most women, that's a right brain. So as a byproduct, they become right brain dominant, and then they become that scoliosis type problem. This is why we see, if you do proper neuro and biofeedback, when you communicate to the left brain, the left musculature gets strong and it pulls the spine back straight. And we've seen this with people, up to 40 and 45 degree curves, and the scoliosis goes away. Because the scoliosis is a byproduct of a brain dysfunction, where it's not communicating right. It's not a byproduct of them being bad or anything like that. It's just they've been hyper-stressed and became right brain dominant. So this is one way that we can get low back issues. The major one that I actually deal with is emotional driven, which means that we look at people that have stored emotions of wanting to nurture somebody, wanting to take care of somebody, and that's the uterine or the prostate reflex. And as a byproduct of this reflex, we get low back pain, because those are the nerves that communicate to the low back. Where the prostate and uterus are down here, they go to the low back. So if that place is overstimulated because we're storing a lot of emotion in there, then we get low back pain. I'm a prime candidate of this. I have the perfect curve in my low back. And whenever my baby, my practice is under attack or something's going wrong with it, I get low back pain. And it has nothing to do with how my spine is aligned. It has to do with how am I dealing with stress and how is my body reacting because of it. So I get really stressed out. I store all that energy down for the prosthetic reflex, and as a byproduct, my body will actually misalign itself because it will overstimulate. It's called a visceral somatic reaction, which means it overstimulates one part, the body will go up, the brain will become overstimulated, and it will cause rotations. So the body moves it because of that emotion that I have. And then I see my chiropractor, and he adjusts me, and by adjusting me, he puts stimulation in to balance my brain. That's how chiropractic works. It's a biofeedback loop to stimulate the brain and balance it out. And when the brain is balanced out, then you heal. As a byproduct of having a balanced brain, your IQ is going to go up. Your ability to fight off diseases is going to go up. Your ability to stop diseases is going to go up. Your immune system goes up. All these things increase because your body takes care of itself. The majority of people have low back pain because of an emotional stress. My experience, it's 80% of that.
80%?
80% of people who come in with low back pain is this an emotional stress every single time. And they're storing it and they're not letting it out. And as soon as my little baby's okay in my practice, guess what happens? No more low back pain. It goes away. And we'll see the same with people. I gotta go on vacation, so they go on vacation, their back pain's gone. They come back, as soon as they think about going back to work, they have back pain.
Oh, I can't go to work.
So that's the biggest one. We'll also see toxins causing issues. You know, if you have specific toxins, it will stimulate specific areas, but that's not usually the one. Number one, I see low back pain is because of emotional stress. Number two, some sort of a traumatic accident or repeated stress. So how do we nullify that? How do we deal with it? And what we need to understand is that what we're dealing with is a subconscious driver. What that means is those little tapes that you're taught of how to deal with the environment and how to deal with the world for the first 7 years of life, that's what's driving your problems. That's what's causing your issues. When we can help tune into that subconscious driver, that's when your body gets better. So that's like saying, we're taught, and you'll see this in families, you say, I never want to be my father, and then who are you exactly like? Or I never want to be like my mom, and then who are we like? Because we're taught these things. We're taught this is who we are, this is how we deal with things. And unless you go in and reprogram that subconscious, it's going to stay the same. Now, when we look at it, and what I'm going to quote here is some of Bruce Lipton's work. He talks about the conscious and subconscious. And if this is your whole brain, this is your conscious and subconscious together, this is how much of it you're aware of. It's that much, it's that small, it's literally a pin dot. That actually doesn't do it justice. You consciously are aware of less than 1%. It's really, really small. But what drives you are all these subconscious things. Now, we're going to get into the actual neurology of how this works. This right here, this little dot, is beta and alpha. None of your things that run your life are in beta and alpha. What runs your life and determines how you react to things that are your subconscious drivers live in theta and delta. How are we going to get to theta if theta is in here and beta and alpha are out here? And we know these things. Some people, what they'll do is they'll repeat a thing over and over and over and over and over and over and over again. To do it that way, it's like trying to change your house by having a 1-inch hole in your wall and going through there and redoing the whole house. It'll take forever, but you can change things. There's an easy way to do it. And how that works is you have to take the body and put it into a theta state. When you put the body into a theta state, then I can actually change your subconscious tapes. And you do it to yourself. You can change them to whatever you want. Being in that theta state is light sleep and subconscious, and that's where healing, majority of healing happens in alpha and theta, but that theta state is where we change the tapes, where we change the body and how it works. So how do we get there? Well, we can try meditation, but meditation is mainly alpha. So we're close, but we don't really get to the subconscious. We can get in there and play with it a little, but what you got to do is either entrain the brain into subconscious states or do theta training with neurofeedback. And by doing this, you actually train the brain into that theta state, and you can actually be awake while your brain, parts of your brain is sleeping or in a subconscious state. And by being in that theta state, you can actually help change the pathways. So you're like, okay, what does this mean? What this means is I have these glasses, and this is why I have them. They're by Porter Vision. And what they do is through light and sound therapy, they can bring you into a theta state. And then based on what the problem is, if it's a healing issue, a money consciousness issue, or whatever it is, we can actually put that information in and it changes the tape. So it's literally like taking a VCR, if you guys remember what those are, or how do we put it like this, a computer program, and going delete, enter. So you delete the old one and put the new one in, and the old one's gone. But you have to get into that state. If you can't get into theta, you'll never change it. That theta state is the goal. And that's why it's so hard. That's why, have you ever heard of affirmations, daily affirmations? That's why it literally takes saying the same thing for 30 days to change it. Is because you have to get through that subconscious, you have to say it so many times that eventually the subconscious will go, okay, he really wants it, let's put a new tape in. And that's why it's so hard to do that, or to do meditation. Now, if you're a person that's stuck in beta, guess what happens in beta? besides you not being able to change your subconscious, that's where pain lives. You cannot have any pain if you're in alpha or theta. So who are the people that are in chronic pain? Our super achievers. They're going to have a really high beta state. Do you have a
So
question?
no pain in alpha and theta, is that what you said?
Yes. So alpha is that meditative state, and that's why we see people like yogis who can literally meditate, and you can put a spike through their hand and they don't even feel pain. Because they can get themselves into alpha, and their brain is living in
No pain
alpha.
in alpha and theta.
So when you're living in those states, you can't feel pain. And that's why hypnotists can put you into a theta state, rechange your subconscious, and then all of a sudden your pain's gone. That's how that works. But the thing is, your brain has fail-safes, because there's certain tapes that you just won't get rid of. Like, this is who I am. This is who I believe to be. And some of them are hard. Some people, I've met people who want to be in pain, because pain is who they are. I am in pain, that's who I am. I've heard that.
No, it's all that fun.
Exactly. That's what I think. But for them, being in pain means that people will care about them. And if they're not in pain, nobody's going to care about them.
That's the brain.
That's how you think, 100%. So a takeaway from this is, if you're stuck in beta, which means really thinking all the time, and if you want to see if you're stuck in beta, it's real simple. Do you dream? If you don't dream, you're stuck in beta. It's that simple.
If you don't drink?
Correct.
Oh, geez.
Because the majority of the US lives in beta delta, which means you go right from high function.
Beta delta?
Yeah, no, delta is the lowest frequency. It's deep sleep and energy storage.
You
So that's
dream in theta?
you dream. It's deep sleep. Yeah, you dream in theta.
Oh, okay, cool.
So you go right from high beta to delta, which is deep sleep and energy storage. So what do we see in our country? Well, I'm really tired, and then I eat and I gain weight, but I'm still really tired. It's because you're not going through alpha and theta. And that's why you start gaining weight, and you're always tired, and oh, it's hard, it's so hard, I can't do anything. So if you're not sleeping, if you're not dreaming, you're not healing. It's that simple. The next one is, you're somebody who always wakes up. Waking up all the time thinking about stuff. Living in beta. You want to see if you're also in beta? Cold hands, cold feet. This is sympathetic tone as well. Cold hands, cold feet, or dry hands. That means
Looking at me, yeah,
I know. I know, Miss Donna. I got ways to help you. You've literally been in stress for so long that your hands start turning off the energy to be able to do fine motor things and put energy into your muscles so you can defend yourself, because you always think a lion or a tiger is coming to get you. Now, to get you into a relaxation state, we do neurofeedback. The reason why we do bio first is to get you into parasympathetic or feed and breathe relaxation state. Once we can get you past bio and you can actually regulate your different temperatures, like make your hands get warm or cold on demand, make your hands sweat or not sweat on command.
Oh, really?
Yeah, you can train yourself to do that through a Pavlovian response, and that's what we do in here. And when you can train that, then you're at the right place where you can actually make yourself go into parasympathetic. Then we can train your brain to stay in the right frequency. And we can get you to here. Now, the glasses that I talked about, that theta state, the glasses that I talked about, they do what's called entrainment. That means they take your brain and they say, this is what you want to be like, and your brain will be there between, the longest I've seen is 5 days, but usually 1 to 3 days. So you get to feel what theta feels like, or you get to feel what alpha feels like, and you get to relax. But then if you haven't changed the way the neural pathway actually works, you'll go back to beta. And this is where neurofeedback works. We train your body to actually function in alpha and theta states. And then you heal. These alpha states, that's where big crazy ideas come from, very productive work comes from. Beta is really good though, if you need to. If you're stressed out and you got to deal with stuff real quick. That's you're thinking real quick, taking care of things. But for long term, it's high energy intake. And what it does is, if you stay in beta long enough, it will lead to type 2 diabetes. Because
Bread and butter and a bag of sugar, right?
Because what happens is, your body is literally in stress mode all the time. So if you're in stress mode, you gotta run away from the lion, right? So you need a lot of energy. So it takes all the free glucose that you have and moves it into the bloodstream and says, go to whatever muscle needs you. But the problem we live in this world is, do we live in a world where we actually have to run away from a lion anymore? No. That that sympathetic reflex is turned on by some guy flipping you off when you're driving down the road, turn it on the TV, some person calls you. All these things turn it on. So you live at this state, and you keep pushing the sugar back into your system, pushing it, pushing it, pushing it. And what stress hormones are released? Adrenaline, cortisone, insulin. All of these cause the underlying problems that we're seeing with 90% of people. Literally, heart disease is a byproduct of this. Cancer is a byproduct of this. Fibromyalgia, all these things are a byproduct of your body being so stressed that it can't communicate anymore. Let's go back to diabetes. Diabetes, you're not working correctly because you're pushing all this insulin or all this sugar out, but you don't really need to run, so you're draining all your stores. This is how you get that tired all the time. You're taking all the free glucose from your liver as glycogen, from all your muscles, from every place you can get it, pushing it in to your blood, and then we don't have anywhere to use it. So we got to deposit it now. So we got to pump the insulin up. Insulin's real high. Then we take the sugar out and we put it into all the muscles, or not muscles, back into the adipose tissue. But then 20 minutes later, you get stressed out again. So you take all the sugar and push it out again, and then you got to produce more insulin. And now what diabetes is you burn out the islets of Langerhans, and they can't produce enough insulin anymore. So you're constantly producing high, low, 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 and that's why your body gets fatigued. Instead of you eat a meal, you take the energy, you produce the insulin, and then you burn it slowly during the day. We don't do that anymore. We just go up and down, up and down, up and down, up and down. Now the theory was that it was the sugary drinks we eat. Now that can be true if we drink a lot, every 20 to 30 minutes. But it makes more sense, doesn't it, that we're stressed out, and every time we get stressed out, the sugar comes up and then it goes down. Because if you notice when you're stressed out, what do you crave? You crave sugar, right? You crave sweets. You crave salt. We're craving these things because I need something to make my brain work, and I need energy to run away from that lion. But that's not the problem. The problem is we're stuck in defense. So I've gone way over my time. Do you guys have any questions on this? Because I'm going to do a lot more talks on this. But simplistically, if you have pain, you live in beta. If you want to get out of pain, you have to learn to be in alpha or theta. There are simple ways to entrain your brain, like the glasses I have. That's a short-term Band-Aid thing, but a long-term would actually be the neurofeedback. And by doing the neurofeedback, it actually subconsciously changes the way your body works. So I have people come in and we do the neurofeedback, and they're like, I'm going to get it into alpha. And I'm like, if you keep thinking, it's not going to get into alpha, because that's not alpha. And how it works is, when you're there and your brain actually does the right thing, then it will give you a Pavlovian response. That means either we'll see a noise will come on, or something will turn, or something will change, and your brain goes, oh, that's good, let's do that some more. And the more you do it, the more you get trained on how to stay there. And what you do is what's called neural potentiation and neurogenesis, which means that what you do is, by the adjustment, we cause new neural communication pathways. So that's potentiation. And the neurogenesis is, with that potentiation or new nerve growth, the body will actually start communicating properly, and those new pathways can actually be trained on what frequency to go at. So if we can get you directly in to the alpha or theta states, your body will heal. That make sense?
Yes.
And then you can't feel any low back pain.
Oh, okay.
Had to throw that in.
Had to throw that in, yeah.
Swoosh.
Any questions? Okay, cool. Thank you, guys. I got a question for you. Have you ever seen or heard of a child that's had like asthma, and like how that affects people?
My husband did, we outgrew it.
So we hear that, things like that, like we outgrow it. But how does that affect that child? Like, I've heard it explained like this, it's like breathing every day through a straw.
Yeah.
And it's hard, it's like a weight is on your chest. And most of these children wanna play sports, or they wanna do things. They wanna be able to go out and run, and they're told, no, you can't do this. How detrimental is that to somebody's psyche? That you're told you're never allowed to do this because you have a problem. The reason why I bring this up is that I know through neurological based care or functional neurology, we can get kids out of asthma. So think of some friend or family member and understand that if we connect them back to source, that asthma can go away and they don't have to feel that they're not allowed to do something. They don't have to feel like they're not allowed to produce anything.
When you say source, what do you mean by that? Get them balanced or?
Connected back to their brain.
Okay.
So when their brain communicates properly, those muscles will pull equally. And then the neurology will allow the brain to communicate properly to the lungs. And then the alveoli will actually release, and the bronchia will release, and the air will be able to come in and out. That's how you get rid of asthma.
Seems like they would have a very, very high stress level too, because it seems like it's a pretty scary thing when you can't get the
100%.
oxygen you need and, you know.
100%, and then that causes more problems.
More stress
You go into
and
that
fear.
stress, you have an asthma attack, and then you go into that sympathetic that I was talking about, yeah, 100%, 100%. So that's all I ask is if we have somebody, just think about them and go, you know what, my friend or my family member, I know how hard that is. Let's change their life. And let them know that what we do is we do consults, initial ones, where they can come in, I can actually see if we can help them or not. And I don't charge anything for that. Now, if we do the exam, there's a fee, but for the consult, there's nothing. Cool. Thank you guys. Let's get you adjusted.
Great.